Hello everybody, this is the co-occurring class with Dr. Greg, and this is a brief video on instructions for paper 1 with the outline as well. Well, what I really want to show here is just all the bits and pieces, the details that I want to see in paper 1, just to make sure that you all have a clear understanding of what I'm hoping for paper 1. Also, be sure to keep in mind that paper 1 is a separate assignment from the case discussions that will also be due later on in the class. That's going to be more of a just synopsis of your case, where this is going to be a much more detailed presentation here. When you do your case discussion, you're just going to be posting a very brief outline of your case, not this full assessment. Now, if you really want to, you can go ahead and try and post this whole assessment, but I recommend not doing that because I really just want the very brief synopsis of your case so people don't have to read an entire paper when they give you feedback. This is going to be a separate paper. This you're going to make sure to download, or upload to Dropbox and submit at the right date and time. So make sure to check the syllabus for the right date for submitting this paper. Alright, so here is the general overlay. There's 3 pages of outline. Feel free to just use this general structure. Want to see the name, the examiner being you, date of birth, age, sex, date of assessment, all that on top. No, of course you're making this information up. This is meant to be a fictional person. If you are using bits and pieces from real people, be sure that this is unidentifiable, that you're not using the same name, you're not using the same age. Make sure that you really mix up this a lot so that we cannot identify who this person is if you're basing on anyone you actually know. First section is identifying information. Be sure to provide the client's age, their marital status, race, sex, how the client was referred for treatment, whether it was their self, court, attorney, doctor, who thought this would be a good idea for them to come in and look for services. Make sure this is no longer than 2 or 3 sentences. Keep it very brief when you're doing this identifying information. What's the reason they're here, basically? Then you move on to the presenting problem. Provide at least 3-sentence review of the events that led this person to seek treatment: lost home, divorce, child custody, car accident, right? Give us more detail on why they're here, basically. One reason or another, what's motivating them to come in. And then provide a brief statement of what he or she may want to get out of treatment, wishes, hopes, dreams, etc. I would like to see this being some form of quote as well, if we can provide a quote on what they're looking for treatment here. Behavior observations, provide at least 5 observations using those mental status evaluations, which you can get more information on that in the Atkins book. I provide a little reference here. And be sure to mention the following: general appearance, dress, overall attitude during assessment, mood and range of emotional expression, any particular delusions, hallucinations, or cognitive distortions. Just make sure to have that kind of information in there. Whether or not these things actually are in there, or whether or not you're actually seeing this from your client, make sure to just let us know whether or not there are any of these issues. And we move into the substance use history. Be sure to include any relevant substance use history. Only include prescription use if possible addiction or abuse was suspected. Otherwise, include prescriptions in the medical history. Be sure to include these details for each specific substance use in the last 6 months. Their age of first use, family history of addiction to the substance, if anybody else had been addicted to these particular substances, frequency of use, so how often are they using, how much are they using. Of course, you may not have a lot of experience with how some of these drugs work or in what amounts they're taken. Feel free to use your imagination for this. I'm not going to grade you on realism for the exact amounts or frequencies or uses of these drugs. Just do your best. Don't feel like I'm going to grade you on accuracy in terms of how people are using these drugs, because honestly, I still don't get it sometimes with some of these drugs after years of trying to figure this out. You don't need to include the specific dosage or amount per use. Like I said, just do your best. What was the substance ever prescription, or is it still? So that's important, right? We may not be considering prescription medicines in this particular part, but if it once was a prescription, that's a good thing to include because it gives us more depth to their story. Make sure to also include their date of last use so that we understand how long it's been since they last used and how close they are to potential withdrawal symptoms. So make sure we understand a bit of that as well. Provide a brief paragraph regarding the following: any symptoms of substance use. So give us specific symptoms. Make sure you're endorsing specific symptoms. So be very clear about that, right? So look back on the different symptoms of a substance use from lecture 1 and say, do we see a risk of withdrawal? Do we see somebody using larger amounts over time? And are they losing out on recreational activities or other pleasurable activities they used to do because they're using so much? Is this causing medical issues? So make sure that you endorse specific DSM-5 symptoms here. Then tell us about the triggers or any risks of relapse based on the history they give us. What are we expecting from this person's use, and what are they really asking for help for when it comes to their use? Any substance use treatment as well. Have they been to detox or residential or outpatient of any form? Have they been to 12-step meetings? What have they done before? What's worked? What hasn't worked? Give us the longest period of abstinence as well. Like I said before, what worked to keep them abstinent during that time? All right, so then moving on to medical history, and as you notice, this kind of follows along very much with how the assessment lecture went with lecture 1 and lecture 2. So go back to those lectures as well to get a different additional information on just what I'm looking for here. But make sure to stick to this outline, especially to get all the nitty-gritty details. Like we said before, note any medical complications, illnesses, a history of any medical illnesses or diseases or injuries, any other concerns that may be relevant to the client's use or recovery, especially from substance use or mental health, right? We want to see those interactions. Are there any progressive or chronic conditions, disabilities? Make sure to list any sort of medications they're taking as well, how often they're taking it, and if they're taking them as prescribed. Let us know what is working. Do we know whether or not the medical treatment currently is working for them? Next section is the mental health history. As again, just go through the general history of their mental health. If they have any current symptoms, make sure once again that you are listing specific mental health symptoms from the DSM-5 here, and give them some personality, right? You don't have to make somebody sound like they're a textbook case of any sort. If you want to, you can go ahead and just write them out for rote, but I do want you to see you trying to really create a believable person here as well. Once again, I'm not going to rate you on accuracy, but do make sure that you are citing the correct symptoms for whatever mental health disorder you're thinking this person may be diagnosed with. List the client's history of symptoms, psychiatric hospitalizations if they had any, and whether or not the client appears to currently meet any criteria for mental disorder, and if they've been diagnosed in the past. Make sure to get the treatment history in there. Again, have they been treated? So make sure to have that in there as well. And then make sure to spend a little bit of time with the risk assessment. Have they had any attempts? If so, when was the last attempt? Does the client have any current thoughts of self-harm? Does the client have any imminent intent to harm self or another person? For this section, you can just go ahead and say no history of self-harm and no current thoughts of self-harm or harming others. But I do want to see you at least put that much. And I do want to see that you at least somehow went through this ladder here, one way or another, that you at least asked each question in per session. Document if emergency services were called during or after the assessment or if a safety plan was created. Many of you probably won't actually go that far with this section, but feel free to do so if you wish. It would be very interesting for me to read. Then the social and developmental history, knowing pregnancy or birth issues. So when their mother was pregnant with them, do they report knowing of any complications? Make sure to include that. Many of you may just put no pregnancy complications, no birth complications, no early developmental delays of any sort, no learning disorders. Just make sure that you put that in there, that you did ask those questions, because insurance for some places, especially Medicaid, is going to want to know these types of things with your person. Briefly describe other family members. How does the client relate to other family members? You don't have to get an in-depth, but build in enough history here to make to kind of give us a sense of this person and how they relate to their family. Include all current sources of social support, as well as family, friends, and community sources, any kind of strengths or resources they have out there. Know any histories of trauma, abuse, or neglect. How does the client currently relate to any of these traumatic events in their past? And note whether the client practices any particular religion, spirituality, or how they connect or relate to their religion. Also mention whether or not they've experienced any sort of cultural mistreatment in their life as well, such as discrimination in some way. Next section, education and employment. Briefly note how well the client got along with peers in grade school and high school, his or her typical grades, and whether or not he or she performed better or worse in any particular subjects. Did he or she receive any special education resources? So we kind of covered that a little bit in the developmental history. Make sure to kind of mention that as well in here if that was the case. Did she graduate high school? Did she complete or attempt any post-secondary school? Any additional training? Brief history of employment. So make sure you give us a little bit of where they've worked, maybe the first place they worked and most recent place they've worked. What are their goals for education training? Do they want a new job, or are they satisfied with the job they have? Give us some legal history. Note any convictions over the last 5 years and whether any were related to their alcohol or drug use. Provide details pertaining to whether any cases are ongoing or if the client's on probation. Now, once again, I'm not going to be looking for a lot of detail in this one, just because it can be difficult. I mean, there's a lot of parts of legal processions that I'm not super fluent with myself. So just do your best to give us a little bit of detail there. Give us a sense whether or not this person has any legal issues from the past that they're still dealing with. So this is an important section here, the assessment and screening tools. Be sure, because this is an extra part that many people get a little tripped up at, and make sure to read through this. Select at least 2 screening tools to assess both the mood disorder and the substance use disorder separately, right? So we want at least 1 screening tool being used for a substance use disorder and 1 screening tool selected to evaluate whether or not a mental health disorder is going on. Include at least 1 extra screening or assessment tool you may use to either confirm the diagnosis or make a differential diagnosis from another related mental health disorder. So we want to see 2 or 3 at least different screening tools that you are using for this assessment. Provide a brief description of the assessment tool. The number of items, rating scale, symptoms measured, intended use, time to complete. Very brief with that. Provide at least 1 citation that justifies the tool's appropriateness in examining the presence of the suspected disorder. So just a short paragraph, nothing too in-depth, just some of the basic components of the different assessment tools you're using. I'm not going to take any points off if you don't tell me exactly what kind of rating scale it is or anything like that. Just whatever information you can get about it. What I do really want to make sure is that you do provide at least 1 citation for this particular tool. And it's an accurate citation that shows some sort of research on the tool that you've selected. Be sure to discuss the timing of these assessment tools you may want to use. For instance, if your client's initial presented as intoxicated or withdrawal, you may want to start with the CWA, which is designed for evaluating intoxication, just the risk of withdrawal. Wait until the patient is fully detoxed. So basically just tell us when you would use these tools and when you might use them again to see if this person's condition has changed in any way, shape, or form. So just a little bit of information there. Then we go to the interpretive summary. Restate the client's presenting problem and goals, and then we want to integrate critical information from prior sections. Include at least 3 statements that connect 2 areas of the assessment. For instance, reflect on how the client's medical condition may affect his or her addiction to benzodiazepine. So really go back and look at these sections and think about how these things can relate. Medical, mental health, social developmental, maybe something when it comes to the family stressors. I want to see you linking a few of these concepts together, 3 at least. I want to see you be able to put these things together and create kind of a more organic picture of this person and how these things are getting in each other's way for some people, or how they may be supporting each other. However you want to put that together, I just want to see some linking statements. Then provide a brief explanation as to what stage of change the client may be in, and then just give me a little justification of why you think that person is in that state of stage of change. Studying additional information you may still need, like things that you're going to be continuing looking up or maybe asking about in the future. Hint here is it can often be good to establish correspondence with doctors, friends, family members, lawyers, probation officers, other mental health professionals, depending on the client's reported history. So think very broadly about all these other areas that I mentioned here in this little hint here. What else would you want to put together still to learn more about this person? Be sure to include the following 4 details about the client: strengths, acquired skills or abilities, clinical needs they may have, so just any kind of needs that we see are high priority right now, and what their preferences are. I'm kind of going by the SNAP here, S-N-A-P, although I didn't do it quite the same. Finish with a brief description of services that a client may benefit most from given their current strengths, needs, abilities, preference. So that's the last little bit of there. You can just you want to start speculating, postulating what kind of level of service they may be best for, but we'll get more into that when we do the treatment plan. All right, so that's the full outline for the assessment, paper 1. Feel free to let me know if you have any other questions about how this paper is supposed to look. shoot me an email. I hope this is clear enough for you and that you're able to get all these details together. I know the part that may take the most work is just getting some of those screening tools in there. Wish you all the best. Take care.